hypertensive urgency causes severe high blood pressure defined as systolic pressure over 180 and or diastolic pressure of over 120 millimeters of mercury without organ damage. Hypertensive emergency exists when blood pressure reaches levels of systolic pressure over 180 and or diastolic pressure of over 120 millimeters of mercury that can lead to organ damage. It is caused by rapid elevation of blood pressure due to a triggering factor on pre-existing hypertension. This is initiated by an abrupt increase in systemic vascular resistance, which leads to endothelial injury leading to increased permeability. The activation of coagulation cascade and platelets is turned on and deposition of fibrin occurs. Endothelial injury and fibrinoid necrosis of the arteriole occurs, leading to ischemia and the release of additional vasoactive mediators, generating a vicious cycle of ongoing injury.
Hello? Oh my god, hey! Yeah, I mean, I'm doing good. Shh. Yeah, I mean, honestly, I'm just so really stressed out right now with everything going on. Okay, so, I mean, he's not calling me back. I don't know what to do. This baby is driving me insane right now in the car. Oh my god, my stomach. Ugh. Alright, okay, Erica, I'll call you right back. I'm gonna call you back. I have to pull over. I'm not feeling good right now. Right now. Okay, I mean, I should call 911. My head hurts so bad. My stomach. Oh my god. I forgot to take my blood pressure medications today. Oh, of course it's empty. Where the heck is a freaking cigarette when you need one? Oh my god. Okay, I have to call 911. Hello? Hi. Yeah, I mean, I'm not feeling good at all. I'm starting to have chest pains and my head hurts really, really bad and I just don't know what's going on. I don't feel good. My stomach is hurting so bad. And I'm pregnant and I'm really stressed out. Can you please get an ambulance here, please? I really need your help. Sure, I'll stay on the line.
The signs and symptoms vary from patient to patient due to the hypertensive emergency being directly related to the particular and organ damage occurring. Most often patients experience chest pain, dyspnea, neurologic deficits, eclampsia in pregnant women, headache, blurred vision, seizure, swelling or edema.
Erica, can you tell me the 5 signs for compartment syndrome?
Yeah, there's pain, pulselessness.
Okay, you're going too slow. I'm going to move on. Inflammation. What are the signs for inflammation?
Yes, what's up? Are you busy?
No, we can. What do you mean?
I have a 25-year-old female with head pain, chest pain, she's pregnant, and she's having severe stomach pain. Also
Okay, can we hear now?
Yeah, let's go.
We talked to them, so we know our history. We're going to go ahead and start with review of systems, okay?
All right.
Nina, how are you feeling?
I'm so tired.
Still a little confused?
I'm just really tired. Yeah.
All right. Have you had any dizziness? No? Any changes in vision? No blurry vision? Okay, and how about, have you noticed swelling into your feet or your hands, or coldness and numbness? No? Have you been nauseous or vomiting?
No.
No? And have you seen any bleeding, unusual bleeding because you're pregnant?
No, I haven't.
No? And no stomach pains or like abdominal
Just earlier,
tenderness?
that was it.
Yeah, that's it? Okay, and any changes in bowel habits?
No.
Okay, we're going to go ahead and do just the physical exam really quick on you, okay? I'm going to take a listen to your heart. And can you take a deep breath for me? Good. And go ahead and do the same thing. Good. And we already have the vitals on her, right?
Mm-hmm.
Okay, good. And then I'm just going to take a look in your eyes. Have you you had pregnancies before this one?
Yeah, this is my second baby.
Second baby? Okay. You go ahead and just look right over my shoulder. Good. Okay. And then I'm going to go up to the other side. Erica, you want to take a look?
Yeah.
Do you see anything there?
No.
Okay. And then I'm just going to see, is there tender at all? She has no swelling or anything like that. How about your tummy? Anything? No irregular pain when I press on your baby? All right, let's go ahead and go talk about our findings.
Physical exam findings: carotid bruits, murmurs, gallops, pulmonary rales, diaphoresis, retinal hemorrhages, exudates, papilledema, jugular vein distension, peripheral edema. Differential diagnosis: anxiety disorders, apnea, cardiomyopathy, drugs, congestive heart failure, pulmonary edema, hyperthyroidism, myocardial infarction, and stroke.
Summer workup, our HPI, our physical exam, what labs and other things would you want to order right now?
I think we should get a urinalysis, a CBC.
Okay.
I would feel comfortable getting a complete metabolic panel.
Good.
Get her hooked up to an EKG right away. And
Anything for the baby?
an ultrasound. We gotta
Okay,
check
good.
the baby.
We want to make sure the baby's doing well.
Yeah.
And what if I said we need to do a CT scan and chest x-ray right away?
I agree, but I think we should take precautions because she's pregnant.
Okay, so we'll leave those for last. And then for our differentials, she hasn't had any prenatal care based on the HPI. What do you think we should keep in mind for the differentials?
Preeclampsia or eclampsia.
Very good. So hopefully, I think she might be going towards the hypertensive emergency, but
Okay.
let's always keep those in mind.
Perfect. Sounds good.
And we should also order cardiac markers just to make sure it's not an MI.
Okay.
Workup: urine analysis, CBC, CMP, cardiac markers, EKG looking for ST and T wave changes, chest x-ray, CT head scan, drug screening, and pregnancy test.
Hi Nina, how are you doing?
I'm just feeling a lot better though.
Okay, so we came to a diagnosis. It's hypertensive emergency.
What's that?
So what it means is, well, do you know what your blood pressure is?
Not right now.
I mean, do you know what blood pressure is?
Oh,
now?
yes, I
Okay,
do.
okay, that's good. It's it was over like 200 over 95, so that's really, really high. That's not normal.
Oh, wow.
So that's really bad for you and your baby. Not going to be good for your body. So we're going to do a lot of things to help you right now. Erica's going to give you some patient education to help prevent this in the future because that's not good for you.
Okay.
All right. Well, I see in your chart that you are a smoker. Is that correct?
Yes.
Have you ever thought about quitting?
Sometimes.
Sometimes. Well, we recommend that all pregnant women and non-pregnant women actually don't smoke, and we actually have some resources for you. And if you want to get some of those on your way out, we can give those to you. And also, it's really important to be compliant with your medication. So when you see that you're running out, probably around 10 pills left, we recommend that you come in and get your refill so you don't have to have this happen to you again.
Okay.
Do you have any other questions for us?
Is my baby okay?
Yes, your baby
Okay.
is doing well.
Good.
And you are too. So we're going to have you stay here for a few more hours and then you're going to get discharged, okay?
Okay, thank you.
Bye.
for my appointment.
Okay, and can I just get your chief complaint?
Yeah, I hurt my ankle last night.
Okay, and what were you doing while you did that?
I was taking a spin class and I fell off my bike.
Okay, I just need to put that on your chart. If you can have a seat, they'll be right with you.
Okay, thank you.
Hi, my name is Lynn. I'm the physician assistant here at the clinic. What brings you in today?
My right ankle is really hurting.
And what happened?
I was taking a spin class last night and I fell off my bike.
That's rough.
Yeah, it was pretty rough.
And how long ago was it? It was last night?
Yeah.
And what kind of pain is it?
I would say like a dull pain throughout my whole ankle.
Can you bear any weight on it?
Barely.
Okay. Well, we're just going to just check the range of motion on it, and then we're going to send you the x-ray and just make sure that everything's okay.
Okay.
Does this hurt at all?
Yeah, a little.
And where's the pain mainly?
Probably right here.
Okay. Can't press against my hand a little?
Barely, that hurts.
Okay. Well, before we send you to x-ray, I just want to talk to you about your blood pressure. It looks really high, and it's our biggest concern right now because it can affect other systems in the body. Let me just ask you some quick questions.
Okay.
Are you on any hypertensive medication at all?
I am.
And are you really compliant and sticking to the regimen of the medication?
No, I don't really like to take medicine.
Well, that's really important to take those meds.
Okay.
Do you have a family history of hypertension then?
My dad had it, yeah.
And do you use any illicit drugs, smoke,
No.
any alcohol use at all?
No.
Okay. Do you have any symptoms with, do you feel any kind of shortness of breath or?
No, I feel fine.
Okay, well, let me go talk to my supervising physician, and we're just going to go from there and possibly do more exams to see if it's affecting anything else, okay?
Perfect. Thank
All right.
you.
I'll be right back. Dr. Long, are you busy?
No, what do you need right now?
I have a 24-year-old female patient who came in today with a chief of complaint of an ankle sprain.
Okay.
But I'm more concerned of her hypertension.
Okay. What is
her
the blood
reading
pressure?
is 220 over 132.
Okay, does she have like family history of hypertension?
She does. She's not compliant with her medication. I just want to check with you with what kind of lab test should we order from here to make sure that it hasn't affected other organs.
Okay, did you double check her blood pressure when you came in?
Not yet.
Not yet? Okay, so make sure when you come back to the patient, you check the orthostatic blood pressure and the patient being supine, as well as both left and right arm, just to make sure we don't rule out any aortic dissection. Okay, does she have any other associated symptoms?
No, she's asymptomatic, no complaints, no problems at all.
Okay, well since she's asymptomatic, let's just order her some labs just to double check everything. We're going to order her CMP, make sure her electrolytes are all in order, and then a urine analysis to make sure no hematuria, proteinuria, any red blood cell cast, and then let's order her some, let's see what else, BUN creatinine, and just to check her kidney functions, and then a CBC just to make sure there's no blood loss or any other infections going on right now. Okay?
Okay, so I'm going to go send her to the lab, also get x-ray of her ankle, and then do you want to come in and check her out?
Yeah, let's go ahead and do a physical exam with her together.
Okay, thanks. So I checked the blood pressure again. It's still very elevated. There's no orthostatic changes.
Okay.
Hi.
Hi.
So this is Dr. Long.
Hi.
Nice to meet you.
Nice to meet you.
She's just going to go through the physical exam with me today.
Okay.
So your blood pressure, I don't know if the nurse told you, was really high. It is actually 220 over 132.
Is that high?
Yeah. Do you know what normal is?
No.
So normal would be 120 over 80.
Oh, wow.
Yeah. So pretty high. We're going to go ahead and do a physical exam on you today and just make sure that everything's good to go.
Perfect.
Here, the PA student is beginning her physical exam. The main systems we're going to look at are the eyes, lungs, heart, GI, as well as neurology. We want to make sure there is no end organ damage. She first checked visual acuity on the patient. This here is also checking her cranial nerves to make sure her eyes are intact. She's doing the H test to test for EOMs as well as accommodation. She then does a fundoscopic exam. It is important to look for any papilledema, exudates, or anything that may cause the patient to lose her vision. She's also testing the pupil's reactions, looking for perla to make sure her eyes are all functioning normal. Here, the supervising physician now steps in to do a full cardio and lung exam. She starts out with inspection and palpation, looking for any heaves, thrills, PMI displacement, as well as JVD. We want to rule out congestive heart failure and other cardiomyopathies being the underlying cause to the hypertension urgency or emergency. She will also auscultate using the diaphragm and the bell, looking for any murmurs, rubs, gallops, S3s, and S4s. This is a good time to also check the pulses to make sure they are 2+ or if they're bounding or weak. She will also look for aortic regurg, having the patient lean forward using the diaphragm. She also will look for carotid bruits using the bell of the stethoscope. On the abdominal exam, she'll also look for bruits of the iliac femoral arteries as well as the aortic artery. She is now listening to the lungs for any wheezes, bronchi, absent breath sounds, and shortness of breath. Now the PA student is performing the neurology exam. She is going to check all the cranial nerves 1 through 12 to make sure they are intact. If our patient was showing signs and symptoms of a hypertensive emergency and urgency, we would do a much more in-depth neuro exam. However, our patient is asymptomatic, so we will check the cranial nerves to make sure they're all intact, as well as deep tendon reflexes. We want to check for sensory, and if she did not have a bad ankle, we would look for gait to make sure she had no loss of balance. The final exam performed today by our supervising physician will be the GI exam. This exam is important because we're looking for any kidney pathology as well as aortic aneurysms. Kidney pathology is a sign of end organ damage. It is important to ask our patient if she's had a history of hematuria or any changes in bowel or urinary function. Our labs will also help us with our kidney function. The supervising physician will do a full abdominal exam to rule out any other causes of the hypertensive urgency or emergency. It is always important to do full exams to make sure we do not miss anything important. The supervising physician will also feel for any aortic pulsations or widening of the aortic pulsation.
Hello, Miss Ventrella. How are you feeling now?
Good.
Still feeling good? Okay. So we actually got some of your lab results back, and some good news. Everything came back negative. You don't have any concerns at this time. But I do need to keep you here for at least another hour. I'm going to give you an oral antihypertensive medication called clonidine. I just need to make sure it decreases before you leave here. So if you have any symptoms in the meantime, let me know, but that's what I'm going to give you for right now, okay?
Okay, perfect.
Okay, and then we're going to just talk about some preventative measures on how you can really control your hypertension, especially since you do have a family history of hypertension. Please remember to be compliant with that medication. Maybe take it every day in the morning with your breakfast or something that you can remember. How is your diet?
Good. I like chocolate, so I get a lot of that.
Well, you should think about limiting your salt intake. That would help with the hypertension, and continue to exercise and just healthy decisions and habits. Okay?
Thank you.
Okay, so we're going to go ahead and give you the oral agent, and if in the meantime you feel any kind of symptoms are abnormal, let me know, and then we'll double check you, make sure everything's okay, and if your blood pressure doesn't decrease by the time you leave here, we're going to have to admit you, okay? So, all right, we'll be back.